Dr. Larson here. Just wanted to take a little bit of time to talk you through how you might save some money on prescriptions. And these are a lot of the tools that I use to help patients on a daily basis. So I'm going to start with GoodRx. I'm on my computer, but you can get this as an app on your phone. This is probably the first coupon-based app for pharmaceuticals that came out. And after you download it or use it on your computer, you just type in the drug name that you're looking for. And that I've typed in tizanidine, which is a generic for Xanaflex, which is a muscle relaxer. This is a good site or service to use for kind of those one-off prescriptions. In a second, I'll talk about chronic prescriptions like cholesterol or blood pressure medications. And you're probably going to get your best prices at H-E-B and Walmart if you're okay going there, or if you can go there. If not, certainly GoodRx and other app-based services are a good path for that. But what I find is you could either use the app to shop in general for pricing for any medication, but you tend to get your greatest savings on these kind of one-off antibiotics or muscle relaxers, things that you would kind of use for a short time period. So GoodRx, and we got pricing for tizanidine, 4 milligrams, 30 tablets. Costco is a little bit more than $8. And what you would do is just click the Get Free Coupon button, and you would get this coupon right here. And when you get to the pharmacy, after you pick up your prescription, you would just show this coupon to the pharmacist, and they would put all the information in. You would be able to buy it for this price. You do need the information from your doctor so that you can generate the coupon, so ask for that if you need to. And that's goodrx.com. Next one is another app. This is RX Saver, and you would just do the same thing to get a coupon for that. And so you can see the price is pretty darn close, but you might just try to switch back and forth in between those two to find the lowest price when you're going to use an app. Next up, I've got Walmart, and they've got a long list of medications. I won't take you through all of them, but all of these are $4 to $9 or even $24 based on if you're getting a month's worth or 3 months worth of medication, but really inexpensive generics, going to walmart.com and looking at their $4 list. Same thing if you have an H-E-B close to you. You could find this on their website in their pharmacy section. I won't take you through everything on this PDF just because the type is so small. But once again, if you're on a medication and you take it every month, this is a really good place to start. For medications that tend to be really expensive these days, for newer diabetes medications, newer medications to treat autoimmune diseases like rheumatoid arthritis, or medications to treat asthma or COPD. Those are all tend to be really expensive. And I've given you an example here of the BEAR Patient Assistance Foundation, and they've listed some of the medications that you could sign up for a scholarship for. I tend to use these for IUDs, so for them they have a Kyleena. But if you're using one of these medications, what I would do is just type in Google, type in the name of the medication, and then patient assistance. And you may see that there's a patient assistance program for one of those. So I would use that in these scenarios. You could also obtain prescriptions from Canada, and you would just kind of take your prescription and send it to them. You want to make sure you use a reputable pharmacy, and if you go to CIPA.com/CIPA-safe-pharmacies, you can find a list of kind of verified Canadian pharmacies that you could trust. And then here's an example from mapleleafmeds.com of Flovent, which is a steroid inhaler used for it's used for asthma, and you can see here for the 50 microgram dose for the discus for a month's worth, it's $38. I searched for this on GoodRx, and it's about $200 that I can find here in town. So they're decent savings if you want to go that route as well. Well, I hope you learned something, and if you have any comments about this or any tricks of the trade that I don't know about, please let me know.